Hi, I'm Dr. Christina Hibbard, and welcome back to 3-Minute Therapy. In my last video, I talked about postpartum obsessive-compulsive disorder and how it is the most misunderstood and misdiagnosed of all the pregnancy and postpartum mood and anxiety disorders. Today, I want to talk about diagnosis and give you a few tips on getting the proper diagnosis for postpartum OCD. Unfortunately, postpartum OCD is often mistaken for the more severe and rare postpartum psychosis, which affects about 1 in 1,000 women versus OCD, which affects about 3 to 5%. When we talk about diagnosis, it's important to keep a few things in mind to rule out psychosis in order to make sure the mother gets the proper care that she needs and we keep the families safe. First of all, in pregnancy and postpartum obsessive-compulsive disorder, mothers have high anxiety. They have these mental images and thoughts, as we discussed in the last video, and if you haven't checked that out, please check that out for more on the symptoms. These mental images and pictures involving harm coming to the baby in their head, they come intrusively. The mothers do not believe in them, they do not want them, and they intrude upon the mother in her mind. She has great distress over these thoughts, and because of that engages in compulsive behaviors to reduce the anxiety. But that distress is very important because it helps distinguish from psychosis. In psychosis, the mother is experiencing a break with reality. She is not in her right mind and she does not know that. Psychotic people do not come in saying, there's something wrong with me, I don't know why I'm feeling this way or thinking this. Psychotic people instead might be brought in by a family member saying there's something wrong with them, they are not acting normal, this is not them, they're not acting like themselves at all and they don't even know it. So in psychosis, the mother would be believing these bizarre thoughts and it would make her feel comforted and okay. She would actually think that whatever she's thinking is the right and good thing to do. Versus in OCD, mothers do not think that what they're thinking is right. In fact, they are horrified by their thoughts and can't wait to get some treatment for themselves to help themselves feel better. In fact, if a mom is saying, I'm afraid I might become psychotic, they're not psychotic because psychotic people don't know they're psychotic is the way I see it. Now that's a really important distinction. Also, psychosis is more acute, meaning it happens more suddenly, usually within the first 7 days postpartum, and it involves immediate treatment to protect the life of the mother and the baby because there is about a 10% infanticide and suicide rate associated with psychosis. Unfortunately, many mothers with OCD are diagnosed with psychosis, like I said before, and we want to try to prevent that, to keep those mothers safe. OCD is more gradual, and usually some symptoms usually occur postpartum. It could occur a few days or weeks or months even postpartum, and if mothers wait to get treatment, they can intensify in their symptoms. Sometimes mothers come in pregnancy with postpartum OCD, and sometimes it's 9 months after the baby's born. So there's much wider range, and again, it's not this acute, they need to be hospitalized because something is definitely wrong quickly kind of thing where there is with psychosis. So those are a few of the differences. The most important thing to remember for families and providers alike is if you're not sure you're getting the right diagnosis, if you're not sure you understand the right diagnosis as a provider, to always get a second opinion, to talk to people who are, to providers, mental and medical health, who are trained and understand these disorders so that we protect the families, protect the children, and also make sure we give the mother the best possible care for the whole family. And that's the differences between postpartum OCD and psychosis, but I hope you will learn more about this on my website at drchristinahibbard.com, and I'll see you next time as we discuss this a little bit more.